Hello, and welcome to ACLM's Vodcast on lifestyle medicine and occupational therapy, presented by Doctors Shelly Norvell, Zipporah Brown, and Amy Sadek.
Greetings and thank you for joining us as we'll be discussing integrating lifestyle medicine into occupational therapy education and practice. Before we get started, we'll take a moment to briefly introduce ourselves and I'll get started. My name is Dr. Zipporah Brown and I'm an assistant professor at Hawaii Pacific University's OTD program in Las Vegas. And I'm also a community-based practitioner in Central Western Oregon. I've been board certified in lifestyle medicine since 2022.
Hello there. My name is Dr. Shelly Norvell, and I am a clinical associate professor in the School of Occupational Therapy at the University of Puget Sound. I also serve in the role as faculty advisor for prospective students, and I have been certified in lifestyle medicine since 2022.
Hello, everyone. My name is Dr. Amy Sadek, and in my current role, I serve as the Director of Capstone Education and an assistant professor to Hawaii Pacific University's OTD program in Las Vegas. And I became board certified in lifestyle medicine in 2021.
During this presentation, we intend to examine the distinct connection between lifestyle medicine and occupational therapy, as well as describe how to implement lifestyle medicine competencies in conjunction with the 2023 ACOTE standards within occupational therapy education, both didactic and experiential. And then lastly, identify instructional strategies specific to integrating the principles of lifestyle medicine within occupational therapy curriculum. In the United States, lifestyle-related health problems have surged to alarming levels, marking a significant public health crisis due to the widespread incidence of chronic diseases. According to the National Center for Chronic Disease Prevention and Health Promotion, chronic diseases are broadly defined as conditions that last for 1 year or more, requiring ongoing medical attention and/or limiting daily function and engagement in meaningful activities. Factors such as physical inactivity, poor diet, smoking, and other environmental factors have driven a rapid increase in chronic conditions, including obesity, cardiovascular diseases, type 2 diabetes, and cancer, thus affecting millions of Americans. So let's explore some data that will help us to better understand the scope of this crisis. According to the Center for Disease Control, approximately 60% of adults in America have at least one chronic disease, and 4 out of 10 American adults have at least 2 or more of these lifestyle-related chronic conditions. Further, in 2020, it was reported that 1 in 3 adults are estimated to have pre-diabetes. This is a condition where blood sugar levels are higher than normal, yet not high enough to be diagnosed as type 2 diabetes. A few of the risk factors include being overweight or obese, having high blood pressure, and also having a sedentary lifestyle. Having prediabetes is a critical stage that often precedes diabetes and provides a valuable opportunity for prevention or even the delay of the onset of type 2 diabetes. However, because there are no clear symptoms, more than 80% of individuals with prediabetes are unaware of their status. Additionally, 1 in 3 deaths in America are linked to cardiovascular disease. Now, cardiovascular disease is a broad term encompassing a range of conditions affecting the heart and blood vessels, ranging from coronary artery disease, hypertension, and even heart failure, to name a few. And it's estimated that currently half of all Americans have cardiovascular disease. So coupled with this monstrous chronic disease public health crisis and some of the data that we've explored, we're also amidst a stress-related mental health epidemic as well. So I'm going to pass it over to Dr. Sadek to describe the impact of stress.
Okay, the statistics just shared are staggering and also connected to stress. And the reason that chronic ongoing stress is problematic is because it activates a cascade of events. Oxidative stress activates inflammatory responses, which are linked to the underlying cause of many of the most common chronic diseases. The long-term impact of chronic stress causes cellular damage to our DNA, proteins, and lipids, which then leads to the ultimate outcome of an often preventable chronic disease. From an economic standpoint, more than 43% of US adults are dealing with the harmful effects of stress. And more than 75% of all healthcare visits are due to stress-related factors. The US economy loses over $300 billion annually due to stress-related costs. And according to the American Institute of Stress, 39% of North American employees report that their workload is their main source of stress. 49% of 18 to 24-year-olds report high levels of stress when they compare themselves to others. 71% of US adults with private health insurance say that the cost of healthcare causes them stress, while 53% with public health insurance say the same. 54% of Americans want to stay informed about current events in the news, but find that news causes them stress. 42% of US adults cite personal debt as a significant source of stress. 1 in 4 Americans, adults, say that discrimination is a significant source of stress. And then the uptick in mass shootings has been a significant source as well, across all races. So as you can see, these are really big numbers economically, and there's a really large burden, of course, on the body physiologically and mentally.
Further magnifying this public health crisis, this graphic illustrates a variety of historically oppressed groups that are disproportionately impacted by a range of health issues. In comparison to non-Hispanic white adults, Latino adults are 47% more likely to have type 2 diabetes and have a higher risk for amputation. African American adults are 50% more likely to have a stroke. Indigenous American adults are 30 to 40% more likely to die from heart disease, and obesity is more pervasive among these three groups. Lastly, Asian American and Pacific Islander adults are 65% more likely to die from liver cancer. This data, which is a snapshot, demonstrates that in addition to lifestyle choices, we must also consider additional lifestyle factors. Historically marginalized folks have an even shorter lifespan and worse health outcomes for a number of factors, including lack of access to fresh and healthy foods, increased exposure to toxins such as lead, higher levels of stress, experiencing discrimination, racism, and accompanying generational trauma. Beyond this, historically marginalized communities are disproportionately susceptible to challenges with being able to work, having higher medical bills, and ultimately experiencing a lower quality of life. This graph illustrates that most of the leading causes of death are preventable. At least 7 of the leading causes of death are inextricably linked to lifestyle-related factors, the potential 8th being Alzheimer's disease. The National Institute of Health have begun to refer to Alzheimer's as diabetes of the brain or type 3 diabetes. Taking a moment here to acknowledge that this data represents more than just our clients and our future clients that will be served by our students. These numbers also impact our loved ones, including families and friends, and maybe even some of us listening to this podcast. Health expenditures continue to increase as a result of this as well. They've risen from $4.1 trillion in 2019 to $4.5 trillion annually in 2022. This is an increase of billions of dollars in just 3 years. And 90% of these expenses continue to be associated with addressing chronic physical and mental health conditions. Despite these allocations, we continue to rank last in mortality and morbidity among the 11 wealthiest countries. So again, we have a monstrous chronic disease epidemic in the United States of America, and it's been ongoing for decades. So we're looking at generations of illness. And this epidemic not only imposes an undeniable burden on healthcare systems, but also takes a toll on individuals' quality of life and overall well-being. So in order to address this crisis, it's imperative that the nation adopt comprehensive, multifaceted strategies that encompass prevention, education, and advocacy that promotes healthier lifestyles that also mitigate the growing burden of chronic diseases in our society. A growing body of evidence has shown lifestyle medicine to be a promising solution. Lifestyle medicine is defined as a medical specialty that uses therapeutic lifestyle interventions as a primary modality to address the root causes of lifestyle-related chronic conditions through prevention, management, and even reversal. Lifestyle medicine certified practitioners are trained to apply evidence-based, whole person, prescriptive lifestyle change interventions addressing a whole food plant-based eating pattern, regular physical activity, restorative sleep, stress management, social connection, and the avoidance of risky substances.
So now that we've learned more about the pillars of lifestyle medicine, here we have the visions of two complementary fields and organizations. The vision of the American Occupational Therapy Association states that as an inclusive profession, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. And the vision of the American College of Lifestyle Medicine states that a world in which all physicians and allied health professionals have been trained and certified in evidence-based lifestyle medicine, integrating healthful behaviors into their own lives while incorporating a lifestyle medicine first approach to treating root causes of lifestyle-related diseases into their clinical practice. So these visions really highlight the intersection of occupational therapy and lifestyle medicine. Both visions support evidence-based practice and emphasizing healthful behaviors, leading to an overall improved quality of life. So now that we've kind of established the 6 pillars of lifestyle medicine and that overlap between OT and lifestyle medicine, let's highlight the direct connection to our areas of occupation, which there are 9 of, but for the sake of time, in red are the ones that really illuminate the overlap, including health management, which includes social emotional health, symptom and condition management, physical activity, and nutrition management, which, as you can see, already covers 3 of the 6 pillars in just one area of occupation. We also have rest and sleep as its own distinct area of occupation, and social participation, which also align with the pillars of sleep and social connection. The OT practice framework really highlights that we are already lifestyle medicine practitioners, and we are called to practice from this, teach from this, and advocate from this, as it really provides the necessary language that equips us with the justification for our role in health promotion and disease prevention. And that work really starts in the classroom with our students, who are the future of the profession. So when we teach about health promotion and lifestyle factors, we should really follow that OT process. For example, evaluation and assessment instruments that look for things like stress, using health promoting occupations as a means for intervention. And then again, evaluation for those outcomes like health, well-being, and quality of life, all of which are justified in the OT practice framework.
These next couple slides further emphasize occupational therapy's role as it relates to health promotion, disease prevention, and restoration. The American Occupational Therapy Association identifies occupational therapy practitioners as distinctly qualified to impact the health and wellness of those with or at risk for chronic conditions through health promotion, disease prevention, and also management through intervention. Additionally, current evidence illustrates that occupational therapy practitioners can improve occupational outcomes in people with a variety of chronic conditions. A huge component of addressing lifestyle factors is also associated with performance patterns, including habits, roles, routines, and rituals. In a scoping review authored by Dr. Aaron Epley and colleagues, they identified and described relevant literature related to addressing habits and health promotion in occupational therapy practice across the lifespan in various settings. An example of this might be an occupational therapy practitioner working in a community-based mental health setting, in which they can facilitate a health promotion group using meal preparation as a means to provide education on the benefits of healthy nutrition, as well as the other pillars of lifestyle medicine, facilitate reflection and skill building related to symptom and condition management, and also encourage problem solving to overcome barriers to engagement with an intended outcome of implementation of sustainable healthy habits and routines. Another benefit is that occupational therapy practitioners are equipped to address the functional implications secondary to a chronic condition through health management interventions focused on improving or maintaining engagement in meaningful activities. For example, an occupational therapy practitioner working in a primary care setting can work with an individual experiencing barriers to occupational engagement due to sensory and psychosocial dysfunction secondary to a diagnosis of diabetes. Occupational therapy treatment related to the individual's impaired sensation may include sensory stimulation and/or adapting impacted activities, and the occupational therapy practitioner can address psychosocial barriers using behavioral health techniques to develop coping strategies to express emotion, such as journaling, building confidence through problem solving, and improving overall resilience to better cope with and improve self-management of their primary chronic condition.
So now let's take a look at some of the accreditation standards within OT curriculum that directly apply the integration of lifestyle medicine. So there are several applicable ones that support this. For the purposes of this presentation, we're going to focus on the newly updated 2023 ACOT standards. We've listed the ones that we found relevant to this connection on the next few slides for you. So looking at B.1.2, the sociocultural, socioeconomic diversity factors and lifestyles really requires us to look at DEI and socioeconomic factors within our curriculum. Looking at the social determinants of health and how they relate to at-risk populations for disability and chronic disease is critical. And then the role in the promotion of health and prevention. This standard really highlights how occupation is a conduit for health promotion, and healthy occupations really lead to health and wellness. Effects of disease processes. So since lifestyle medicine focuses on those most common chronic diseases, it's important to recognize and teach our students about the modifiable and non-modifiable risk factors that contribute to disease processes, as well as interventions that can prevent, treat, and reverse some of the most common chronic conditions. Professional reasoning, this really applies across OT practice settings and frameworks such as lifestyle medicine. So you can see here there are terms around promotion and prevention, so we're not really limited to rehabilitative models of care. Standardized and non-standardized screening and assessment tools. This is a really critical one so that students can be aware of the types of assessments that they can utilize to address things like stress and sleep and physical activity. The American College of Lifestyle Medicine also has a great standardized assessment chart on each pillar. That's a really great resource for members as well. And then the application of assessment tools and the interpretation of those results. So it's not just the administration here going off of that last standard in the previous slide. They also need to know how to interpret the evaluation findings. So these two standards really go hand in hand. And then, of course, providing interventions as we're moving through that OT process. It really gives us language to offer these direct interventions that enhance health and wellness and improve chronic conditions as some of those key terms within this standard. And further in this standard, we also see language around interventions to support well-being, which is also an actual outcome within our OT practice framework. And then with referral to specialists, we see that this is a concerted group effort, and we should be teaching our students to know who to refer and outsource our clients to so that other professionals can maybe pick up a different piece of the puzzle This also lends itself to understanding the clarity of roles among an interdisciplinary team, and even advocating for OT's role within primary care as well. The teaching and learning process is really important, especially when we're talking about health literacy education. How do we connect with a client to resources that are in their native language? We need students to really be aware of these cultural and language components to reduce barriers to access and really to ensure that continuity of care. Community and primary care programs, again, another important aspect when we think about lifestyle medicine and OT, is not just access to resources, but it's also the designing of community programs and ensuring that our primary care physicians have a pathway to referring to us. And then again, interprofessional team dynamics. We also know as OTs, this is an important piece of our role, which is advocating for our profession amongst an interdisciplinary team to share our distinct value and contributions among other key players. So in addition to some of these standards, we wanted to share a sampling of courses that could include the standards that we just reviewed. And by no means is this an exhaustive list. And even if you don't have these courses or with these types of titles in your program, the learning materials, the lecture content, or the assessments can really also focus in on the standards as sort of a workaround to having maybe a specific health and wellness course. So you can start with the standards that we previously addressed, and whatever courses those standards can be used as maybe a guide to integrating lifestyle medicine in your curriculum. And in that case, you could really use maybe a backwards design approach of your courses by starting with the ACOT standards and then integrating them sort of retrospectively into your respective courses. And then in the next few slides, we'll take a look at a few examples of some assessments that you could incorporate into OT curricula. But please know this is by no means an exhaustive list, but rather just a sampling of options. So in the area of sleep, we have the Pittsburgh Sleep Quality Index. Social connection, there's the Promise 10 Global Health Questionnaire. With nutrition, there's 3-day food records or 24-hour food recalls. And for the next 3 pillars with stress, we have the Perceived Stress Scale, physical activity, the International Physical Activity Questionnaire is a popular one. And then with risky substances, we have the audit and the screening brief intervention referral to treatment. And some additional wellness focused assessments may also include the World Health Organization Quality of Life Questionnaire, which, as we recall earlier, is an actual outcome within our OT practice framework. There's also the Satisfaction with Life Scale, and then the 15-item 5-facet mindfulness questionnaire. And these all really target quality of life and well-being, which again, really connect well to our outcomes within the practice framework. And now I'll hand it off to Dr. Norvell to share with you some practical ways to implement all of these wonderful concepts into your curriculum and programs.
Before transitioning into examples of didactic and experiential ways lifestyle medicine can be integrated into curriculum, it is important to examine some of the more common theories OTPs use in health promotion and prevention. This list is not inclusive of all possibilities. However, I chose to highlight those identified in the 13th edition of Willard and Spackman's Occupational Therapy textbook, since that is a commonly used text within curriculums. These were chosen by authors Reitz and Graham due to the commonalities they hold and the potential for blending with one another. As an educator, beginning with theories, models, and frameworks helps students enhance communication and understanding as they work within the interdisciplinary team. This also allows our students to connect to the language of the OTPF and think about how habits, roles, and routines relate to health behavior change. These models and theories also assist students in developing evidence-based frameworks for research and capstone projects. So now that we've covered theory, the OTPF, and assessments, I will share examples of some practical application to both didactic and experiential learning that I've incorporated in my program, and the other facilitators in this lecture have also contributed as well. As you will see on the next few slides, these are some specific ways to include lifestyle medicine supported learning activities within curriculum. And I won't read through each example, but instead will highlight a few on each of the slides. During documentation and assessment assignments, educators can remind students to incorporate questions into the occupational profile in order to screen for potential needs for interventions within each of the 6 pillars. And these are referred to as the lifestyle medicine vital signs. Another example is taking students through a semester-long health behavior change exercise of their own and incorporating tools such as journaling and self-reflection to help enhance the students' understanding of some of those challenges associated with lifestyle change. Finally, on this slide, referencing lifestyle medicine articles to create a student-led journal club can help students more fully understand the connection between OT practice and lifestyle change evidence. The newly published ACLM Cancer Toolkit can serve as a valuable way for students to examine where OTP expertise can contribute in each pillar to support symptom management and quality of life. Using case studies and role-playing can serve as valuable learning activities. For example, within lifestyle medicine, students can role-play a discharge session with someone who has a chronic disease. This challenges students to consider how to address improving symptoms or preventing worsening symptoms, collaboratively set SMART goals with their clients, develop a home program, as well as making specific referrals to other interdisciplinary team members, such as registered dietitians and mental health professionals. In population health and wellness units, students can examine obesity and type 2 diabetes as current epidemics in U.S. healthcare and understand how OTPs can support lifestyle change through calendar planning, creating shopping lists, creating new healthy habits and routines, as well as understanding how the occupation of healthy sleep supports weight management and stress management. As we look to experiential implementation, there are 4 areas in which students can translate knowledge and make connections to lifestyle medicine outside of the classroom. And these are identified as fieldwork placements, departmental and campus community opportunities, and doctoral capstone experiences. Students trained in the principles of lifestyle medicine can educate the educators within some of these settings by bringing in those lifestyle medicine screening tools, assessments, and interventions. And some of these fieldwork, department, and campus opportunities may eventually translate to capstone projects for those in doctoral programs or even future careers. I will provide some further examples in each of these 4 areas on the next few slides. Within fieldwork settings, there are some examples, these are some examples of emerging practice areas where OTPs can make an impact and which are largely underrepresented within the field of occupational therapy. These include community-based settings, primary care clinics such as family practice, internal medicine, and pediatric clinics, and community day centers for older adults or adults with disabilities. Students and fieldwork coordinators can work together to develop partnerships within these settings for both level 1 and 2 experiences. So next we will explore some ways to promote health and wellness among the OT department and campus communities. Some ideas include creating a student and faculty physical activity challenge, such as a virtual walk across America, facilitating SOTA health and wellness student leadership opportunities to create events throughout the year. And within that thought, supporting a lifestyle medicine student membership interest group could be a really exciting way to become a club advisor as an educator, and encouraging those students to utilize the food as medicine microgrants to apply for those for a department collaborative cooking event. Creating stress reduction carts or spaces within the department stocked with healthy plant-based snacks and offering stress reduction tips of the day can really be helpful during exam weeks. Educators or students can offer to present at a campus lunch and learn aimed at students, faculty, and staff. And then finally, working with other departments across campus, such as pre-health, exercise science, psychology, nursing, or graduate programs such as physical therapy or public health, to host guest lectures from experts within the community, including the pillars of lifestyle medicine and introducing those. And these also can really be helpful for providing social connection opportunities. Since becoming board certified and incorporating lifestyle medicine into the curriculum at my university, I've had several students take that learning to the next level with doctorate capstone projects. These are examples of some of the lifestyle medicine focused pre and post professional capstone experiences that I have had the honor of mentoring or am currently mentoring, and I will highlight just a few. Recently, one of my students examined occupational deprivation in homeless shelters within her community and used the lifestyle medicine pillars of social connection, physical activity, and stress management to develop a program for the men in these shelters. This included coordinating a donation drive for exercise equipment, forming a weekly walking group, and training the volunteers working in these shelters to ensure sustainability. The second project I recently mentored was a student who developed a program to prevent type 2 diabetes for a population of adults with disabilities who attend a local day center. The student applied for a university enrichment grant, which allowed her to acquire equipment and food for leading healthy meal prep and cooking classes at the center. She developed a resource manual which included simple, delicious plant-based recipes and safe, low-impact physical activities with adaptations for those with movement restrictions. During her time at the center, she conducted in-services to educate the volunteers and developed a survey to assess confidence in implementing these activities for future programming. I continue to be inspired by the impact of these projects and the students' enthusiasm for carrying them out within these populations. Fortunately, the ACLM provides a plethora of resources for assisting educators in providing lifestyle medicine instruction to our students, and Kelly will go into some further details later in this vodcast. Additionally, the ACLM offers complimentary courses for members and non-members. The Lifestyle Medicine Food as Medicine course bundle offers 3 separate courses for a total of 5.5 hours of CEUs. Educators interested in learning more about applying lifestyle medicine to their curriculum can acquire continuing education units through this valuable offering. So in summary, why is lifestyle medicine important to incorporate in OT education? As we bring this all home and wrap this up, this needs to be an all hands on deck call to action among the healthcare team to address the chronic disease epidemic we face in this country. A lifestyle medicine approach to population care and individual care has the potential to arrest the rise in the prevalence of chronic conditions and their overwhelming costs. Provider burnout is at an all-time high in some respects due to the low satisfaction of treating individuals with chronic diseases and encountering that revolving door of readmissions to hospitals. Incorporating lifestyle medicine into the framework of our care can lead to better health outcomes and improved client satisfaction. OTPs will encounter individuals with chronic diseases in some manner within most of the settings within which we work. This truly is the modern day holistic patient. Lifestyle medicine supports advocacy, as we've heard, for the advancement of health equity through the HEAL initiative or Health Equity Achieved Through Lifestyle. This aligns closely with our charge as OTPs to consider occupational justice, social determinants of health, and advocate for an equitable healthcare delivery system. One does not have to be lifestyle medicine certified to teach this content, nor have a specific health and wellness course, as has been stated already in this podcast. To incorporate the evidence-based information, we all can do this. OTPs hold a valuable role in implementing our training and background to contribute to chronic disease prevention and health promotion. This truly is the foundation of our profession. Thank you so much. Next, I will turn it over to Kelly Freeman, Director of Workforce Development, who will share more about the Academic Pathways Program.